The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Knowing your body can be the key to saving your life, especially when you examine yourself for breast cancer. Breast cancer is the second major cause of cancer death in women, but it doesn't have to be. Hello, I'm Faith Daniels. Welcome to Today's Health. Fighting breast cancer is a major ordeal and involves many tough choices. In this special edition, we'll focus on the battle with breast cancer going on at the University of Texas M.D. Anderson Cancer Center in Houston. For many women, this struggle is a matter of life and death.
I had no family history of breast cancer.
I had no thought that breast cancer would ever occur to me.
Breast cancer is a fatal disease for too many women every single year, and I had breast cancer.
For every woman alive today, breast cancer is a constant threat. About 182,000 new cases of breast cancer are diagnosed each year, and in that time, the disease will kill over 46,000 women. There is no proven way to prevent breast cancer, and that's why it's so important for all women to understand what they can do to detect it early. Breast cancer is a disease where malignant cells are found in the tissues of the breast and can spread throughout your body. These growths can be felt as a lump in your breast.
The women at risk for breast cancer are actually all women, mostly starting at age 40. Our individual risk goes up with age. One of the risk factors is the length of time one menstruates, so that a late menopause or very early beginning of menstruation may be associated with a very slight level of increased risk. But the bottom line is every woman's at risk, and every woman as she gets older really needs to be aware that she needs to be active in participating in ways she can protect her good health.
Most women with breast cancer find their own tumors either by accident or through a breast self-exam. Experts agree the best defense against breast cancer is a 3-pronged approach for early detection. This includes a monthly breast self-exam at the end of your menstrual cycle, an annual breast exam by a health professional, and a screening mammogram every 1 or 2 years for all women over 50.
There may be some cultural barriers for some women about performing breast self-exam or seeing their physician for annual physical exam. Some women have been taught not to touch themselves, and so this is a difficult area for them if now they're being told that this is something they should do. I think our best approach in these women are to train the younger women when they're in high school at a younger age and let them go forward throughout their adulthood with these good practices.
If you feel anything unusual during your self-exam, don't panic. About 80% of breast lumps are not cancerous. Contact your doctor right away. Early detection can save your life. More than 90% of women who found breast cancer in its earliest stages are alive and well. Health experts recommend you examine your own breasts and see your doctor regularly. It's a matter of survival.
Early detection is one of the main reasons more women are surviving breast cancer than ever before. It also gives you more treatment options. If you can detect breast cancer in its early stages, very often surgery can remove the cancer and save your life.
You deal with whatever you have to deal with, and the name of the game is to survive breast cancer. And if they had had to take my breast, that would have been okay if it would have gotten rid of the cancer.
Not too long ago, a diagnosis of breast cancer would immediately mean a mastectomy or removal of your breast, but not anymore. Now there are more options, and the breast can often be saved.
Well, surgery has always been the usual approach to breast cancer management, and particularly if you have early stage disease, surgery may be the only thing that the woman will need. But today it's more common to have a team approach, so in addition to surgery, you may receive either chemotherapy or radiation. Well, the two main surgical options to treat breast cancer is either lumpectomy, in which you take the tumor out with a rim of normal tissue, or mastectomy, in which you completely remove all the breast tissue.
Women who have had a choice between a lumpectomy and a mastectomy and chose a lumpectomy have the same survival rates as women who chose mastectomy. Unfortunately, not all cancers are discovered in the early stages, and too often the breast must be removed.
Well, today, when we consider mastectomy, which is the complete removal of the breast, and usually including the axillary lymph nodes, that's termed a modified radical mastectomy. Modified in that we no longer need to remove the chest wall muscles as we used to do in the old standard radical mastectomies. Radical mastectomies are now a thing of the past. Very seldom would a radical mastectomy is indicated. And this change has come about using the team approach, that in patients that have locally advanced disease, that is large tumors or known involvement of the lymph nodes, the approach today would be to go with chemotherapy first to get the tumor downstage and then have surgery. I think the goal in breast cancer surgery is to meet the patient's expectations and also make sure that you're taking care of the tumor, because you never want to cut corners with cancer. The likelihood of giving it your best shot is on the first go-round.
Preserving as much of the breast as possible can help make a woman's fight against breast cancer less psychologically taxing.
I would say it would have to be to preserve the patient's own body image, that she feels that her body's still intact.
Surgery is never a pleasant choice, but breast cancer is a vicious disease that can kill with no mercy. Fortunately, if you can discover it early, you now have options.
I would have been happy for her to take both breasts. I mean, my goal was not to have cancer anymore, and I had no particular desire to keep any part of me that needed to go.
Our body image can have a significant impact on our mental well-being. The psychological trauma of losing a breast can be far more troubling than the actual surgery. Recent trends in breast reconstruction, however, may help reduce some of the emotional damage of breast cancer.
For most women, a mastectomy is a mutilating operation, and the breast is removed, and many women find this unsettling. They find that it makes them feel less of a woman, less whole.
Even if you are having a mastectomy, you still have options, and one of them is breast reconstruction. Many women are choosing to have it done right at the time of the mastectomy. At M.D. Anderson, they have been combining the mastectomy and breast reconstruction at the same time.
Given my age and my prognosis, that I would be happier psychologically and emotionally and every other way if I, as they say, went to sleep with the breast and woke up with the breast.
A woman can emerge from the operation and still look cosmetically very much the same.
Of course, we try to make the breast look as much like a real breast in the nude as we can. It's not realistic to expect that we can do that every time. Frequently, we come pretty close. And I think immediate reconstruction does help to eliminate some of the harm that would otherwise come to them from having to undergo loss of a breast. There are two basic methods of reconstructing breasts, one with implants of various types and the other is with your own tissues. Most of the reconstructions that we do, in fact the overwhelming majority of them that we do with a patient's own tissues, we take from the lower abdomen. When we perform the reconstruction at the same time as the mastectomy, we're able to preserve the uninvolved part of the breast skin. And we can use that in our reconstruction to form an envelope. And when we transfer normal, healthy, fatty tissue from the abdomen, for example, preserving that skin envelope and the fold underneath the breast makes it much easier to fashion a facsimile of the breast that looks just like the opposite side. We call this the tram flap.
I'm real glad that that's what I decided too, because once I was through with chemotherapy and everything, then I could really start setting about to just live my life, and I didn't have to think about having more surgery of any kind to create a new breast or anything. It was done. It was behind me. And that's worth a whole lot.
A mastectomy can leave a physical and emotional scar. If that procedure is necessary, the option to have her breast reconstructed gives a woman one more choice and a little more control in determining her own fate.
While battling breast cancer, it's very important for a woman to remain strong psychologically. Current research studies are beginning to probe the possibility that maintaining a positive mental state not only helps you cope better, but may even help you get better.
I think we do know that in some instances, brief acute stressors can lead to a temporary lowering of the immune system.
Listening to the sounds of the waves and the chatter of the birds in a tropical forest at the edge of the sand.
The guided imagery movement really stemmed from an interest in the mind over body phenomenon and in attempting to provide a mechanism where someone could actually do a physical or psychological exercise through imaging to enhance the body's own natural defenses.
I think that emotionally, having breast cancer and going through treatment for breast cancer puts you on a little bit of a roller coaster, and so you kind of go up and down.
You hear patients often describe breast cancer as an emotional roller coaster because, like all cancers, it often puts patients in touch for the first time with their mortality.
I thought about death a lot. I really did. I wouldn't say I obsessed about it, but I thought about it a lot.
There were times when depression, it felt like it just, it was almost like it overflowed you.
Depressive disorder is more of a pervasive syndrome in which patients will feel not only sadness, but also will have sleep disturbance, may experience daily crying spells, be more irritable than usual, lose interest in most activities, and become socially withdrawn. Fortunately, it is responsive to a number of psychiatric and psychological interventions. Here at the M.D. Anderson, that we found antidepressant medication given over a period of 3 or 4 months to be very effective in patients. Depression's most malicious effect, I think, is to affect quality of life. It affects reaching out to others for support.
I can't imagine anyone going through this without close emotional support. There are, support groups available. If you need that, then get it, because it's a very difficult thing to go through. You need support from somewhere.
Do you ever feel like information is coming at you far faster than you can absorb it? Fortunately, today's internet technology allows us to give you access to all the subjects covered on our show. So if you need more details or you just want another look, visit our Today's Health website at www.vstar.com. Surgery isn't the only weapon in the fight against breast cancer. Some of the most exciting advances are coming in the form of new medications or therapies. The ultimate goal is to be able to attack and destroy the cancer without surgery, or with only a minimally invasive procedure.
Chemotherapy was hard for me. It's not for everybody. Some people kind of breeze through it and go skiing and climb mountains and do all kinds of things. I was not one of those people.
What are the non-surgical ways to fight breast cancer? Doctors and researchers at the M.D. Anderson Cancer Center are on the front lines of the war on breast cancer, and many of the treatments being studied there will become state-of-the-art. The treatment of breast cancer is evolving into a multidisciplinary approach. A team is created to deal with each patient, and that team may consist of a surgeon, pathologist, radiologist, and an oncologist.
The treatments available to treat breast cancer today are several. We still use the classical treatments, surgical resection. We use radiation therapy, and in fact we use radiation therapy more today than in the past.
I went through radiation therapy after my lumpectomy. I think I had like 25 treatments.
We have hormonal therapy, which is a very useful tool for about a third of the patients with breast cancer. We have cytotoxic therapy, better known as chemotherapy, which is a group of chemicals that kill cancer cells.
Chemotherapy, I guess, was the hardest thing I've ever gone through. The drugs are very powerful drugs. You know that if they're going into you to kill the cancer cells, and at the same time they're killing a lot of other cells in you, that they have to be really strong.
Giving chemotherapy is like a balancing act. You try to give as much of each drug as possible so that you get the maximum cell kill, so that you eliminate as many cancer cells as possible.
Researchers are finding that introducing new drugs is not the only way to improve the treatments. Sometimes varying the procedure can bring different results as well.
Doxorubicin is one of the most widely used drugs for breast cancer. Over the last 5 years, another drug came along, paclitaxel. This is another very effective agent that is probably at least as effective and possibly a little bit more effective than doxorubicin. I think now we have several ways to combine these two drugs that are better tolerated. And the secret appears to be to give them as a very short infusion, as opposed to the longer durations of infusions we used in the past, and to give them in rapid sequence. The bone marrow transplant is not treatment. What it does is that it allows you as a patient to receive doses of chemotherapy that are 5, 10, sometimes 20 times higher than you would be able to receive otherwise. Early detection continues to be the key part of treating breast cancer, because every single anti-cancer treatment we have is more effective in earlier tumors, less effective in later tumors. My hopes for the future are that our systemic therapies will become increasingly effective in killing breast cancer cells, so that we can not only prevent, but I hope someday cure metastases.
Modern science is giving us more and better weapons to battle breast cancer. Hopefully, these treatments will soon be able to prevent a dangerous cancer at any stage from becoming deadly.
I think having breast cancer has certainly made me a stronger person.
I am a breast cancer survivor, and that's a good thing to be.
Women who survive breast cancer know it's an enemy that can be defeated. It requires a vicious battle, though, and no woman emerges unaffected. But when you talk to survivors, it's clear being alive makes the fight worthwhile.
When I was diagnosed with breast cancer, I think the first emotion that I felt was fear.
I felt scared about the unknown of it.
You do a lot of what-ifs when you're diagnosed with breast cancer. Are you going to have a mastectomy? If you do, are you going to be able to pay for it? Are you going to be able to go back to work? Are you going to have chemotherapy? Are you going to lose all your hair? Are you going to be nauseated? There's just a lot of scenarios that go through your mind as to what's in store for you.
Dr. Singletary discussed all of the possible surgeries that one can have, but she was pretty firm from the beginning that what she believed I should have was a modified radical mastectomy. And I trusted her a lot. That's what she thought I needed, and that was fine with me.
Having a lumpectomy as opposed to having a radical mastectomy is much easier to deal with than the other.
I had to sort of look mortality right in the face, and that was tough.
I would wish that every woman could have a husband like I have. He's one of these people that the inner beauty is what's important to him.
My family was really the most important thing because they wanted me to get well and be well. They did everything they could to make that happen. And so, because I loved them and I wanted to be well for them, I needed to do everything I could so that that would happen. I cannot imagine going through that experience without my husband and children. Early detection of breast cancer leads to cures of breast cancer. It's the most important thing.
The thing that other women can glean from this is that it's very important to have early detection because your prognosis is so much better when you catch the cancer early, especially breast cancer.
A year ago today, I was in the middle of chemotherapy, and now I feel fine. I don't have cancer anymore. I am a breast cancer survivor, and that's a good thing to be.
You don't have to wait for a new drug or a miracle cure for breast cancer to increase your chances of survival. Do your monthly self-exam. Visit your doctor every year. And if you're over 50, get a yearly mammogram. Remember, you have the power to save your own life. For more information about breast cancer or any topic covered on our show, visit our internet website at www.vstar.com. I'm Faith Daniels. Join us again next time as we get right to the heart of matters affecting your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.